Well, the American Heart Association's latest current guidelines are out, and there is some changes to the old recommendations that you need to know about. Now, this video is not intended to be medical advice. We're just going over what the guidelines say. If you have specific questions, please talk to your doctor. Now, the document itself is pretty complicated. So if you want more details, check the description for a link to the document. Okay, so what are the big changes? What are we focusing on here? Number 1, it's all about those small changes. They're calling this the stepwise approach, meaning that you don't have to do everything perfectly right away. You can make small changes over time, and as you make those changes, you can see how your body responds. See how you feel, see how your energy level is, see how your blood pressure is, see how your health markers are, and make adjustments along the way. Number 2, they now recommend a minimum of 150 minutes of moderate intensity aerobic activity per week. That's up from the old recommendation of 100 minutes, and they also recommend 2 or more days of muscle strengthening activities. That's up from the old recommendation of 1 day. And lastly, they now recommend against consuming foods that are high in saturated and trans fats. So let's dig a little bit deeper into each one of those. So with exercise, the new guidelines recommend a minimum of 150 minutes of moderate intensity aerobic activity per week. It also says that we should aim for more physical activity if we can tolerate it. There's really no maximum amount of recommended exercise. The guidelines also say that we should spread out our exercise throughout the week, and that we should try to do a combination of different types of exercises, including things like cardio, strength training, balance training, and flexibility training. When it comes to diet, the new guidelines recommend that we consume less than 6% of our calories from saturated fats and less than 3% of our calories from trans fats. So what does that look like in real life? Saturated fats are found in a lot of different foods, including fatty meats, butter, whole milk, ice cream, cheese, whipped cream, certain types of oils like palm oil and coconut oil. Trans fats are typically found in processed foods that have partially hydrogenated oil in them, so things like margarine, shortening, some types of frozen meals, and fried foods. The American Heart Association recommends that we get most of our calories from foods like fruits, vegetables, whole grains, and lean proteins. They also recommend that we limit our intake of added sugars to less than 25 grams or 6 teaspoons per day. If you want more details, check the description for a link to the full guidelines. And remember, these are just guidelines. These are recommendations. You might have to make some adjustments based on your own individual needs and your own individual health status. So talk to your doctor if you have any questions. Lastly, if you're benefiting from any of my content, I would love to hear about your success story. Please share it in the link down below.